Put your feet out in front of you. Lift your chin. Hey everybody, Dr. Todd from Gonstead Spine and Wellness. And in this video, I'm gonna take you through case management of a patient of ours that has a thoracic hyperkyphosis. I'm going to bring you behind the scenes, show you how we go through everything with this patient from A to Z, from the adjustment to the movement assessment, exercise protocols, traction, case management, everything, so that you as a patient or someone who just wants to learn how to get healthy and stay healthy for a lifetime, you can see that these types of methods are available. We do these in our clinic out here in Boise, Idaho. We also train other chiropractors in these systems all over the world. So there's two audiences that we serve. One is our patients and people who just want to learn about health. And the second audience is chiropractors. We teach chiropractors how to put functional movement, corrective exercise, and a lot of the systems that we use in our practice in their practice so they can take care of more of you. How cool is that? All right.
Looks good. Looks good.
Roger knew we were going to film him. He was nice enough to let us broadcast this to the world so everyone else can learn from how we examine him, how we watch him. So the first thing I'm doing, this instrument, this is used in the Gonstead work. It measures temperature from side to side. We run it over the spine multiple times. I'm just fast forwarding through it, and I'll play it so you can see some of this.
Doctor.
Okay, we're having a conversation. So I'm going over the same area multiple times, trying to see if there's any reproducible finding, a deflection or a deviation with that little needle. That helps pinpoint at what level of the spine there could be irritation to a joint, to a nerve. It's one step of many in us figuring out where the problem is. On the first visit when we check someone, this is not the first visit, this is a subsequent visit. This is a patient that's coming in over a course of care, a series of visits. Something that we do is on the first visit, we really check someone in a lot of detail. We take little BBs, like from a BB gun, and we tape those on the surface of the spine, surface of the skin, I should say. And I'll show you, I'll pull this picture in. This is his full spine x-ray right here. Okay, so you can see there's these little white dots everywhere on here, and those little white dots are BBs. So on his initial workup, we scoped him, we palpated, we checked for edema, we checked movement of certain joints, and muscle splinting, spasm. We visually looked at what's going on, and then at those areas where we felt there was likely a problem with a joint, something called a subluxation, where a joint misaligns, becomes irritated, causes a problem to a nerve. Once we found those areas, we identified those with these little BBs so that we can take the exam findings and then overlap that onto the x-ray analysis. There's some other things that we do on this x-ray to evaluate what's going on with the patient. We're going to cover that as we get into this a little deeper. Let's just go through it and just show. So we're scoping, we're going over the skin multiple times.
Yes.
Okay. I'm just going to get right into where we start adjusting. So I'm checking motion. I've worked on his 7th cervical several times. It's a very common segment in the spine to work on. It's a common area in the spine to have a problem with. And here I'll pull this x-ray in again and just show you that, let's see, get this to come down. So C7 is this guy right here. Had a little BB there. This joint's most fixated, it's most restricted. We've worked on C6 in the past as well, but essentially that transitional area in the spine between the neck and the rib cage, that area is just very susceptible to having injury. The head can whip around from injuries, and that cervical thoracic junction is one of the most common areas where the segments become fixated and misaligned, what we call a subluxation. And so that's where we want to focus our attention, not just moving bones to make noise, not just moving bones because it maybe is a little sore or uncomfortable there, but there's a series of criteria that stacks up to say, yes, that's where we're going to adjust. Here's why we're going to adjust. And then in our clinic, what we do, and in our systems, that addresses the segmental component of the joint. This patient, he's got a postural component too. He has a loss of cervical curve. He has some pretty significant bony spondylophytes, so like bone spurs going on in the neck. Here, I'll pull this in over here. We'll show you another view. This right here is marked up showing abnormal curvature. It's not the worst curve we've ever seen. It's flat and straight right in the middle here. However, this is a dysfunctional shape of the curve. Now, he has a bigger elephant in the room, which is his thoracic spine. So his thoracic curve, his mid-back curve, is more of an issue for him. It's more of a priority to start fixing in this initial phase of care. Phase of care meaning we're taking care of him for the next couple of months, 3 months to be exact, and then we have a comparative x-ray scheduled alongside other comparative measures. I'll show you some of the things that we did on the initial workup in just a second after we get through watching him get adjusted. And if you want to see more about how we do spine remodeling traction, which is a key piece of the equation here, we just actually did a video on this not too long ago, so check it out. This is actually his traction card. There's Helena. We're going through a team traction training. There'll be a link up above on this video. You can jump into traction training and dive a little bit more into traction, but it's our same patient here, Roger, who allowed us to video this adjustment. We also covered some of the case management and things that we're doing with them. So in this video right here, we're showing this piece of equipment and Helena's getting set up in traction. I'm just gonna fast forward through this so you can see what this is. And this is used to remodel the shape of the spine. So physically pull someone into an upright position opposite of how they're malformed, deformed, or posturally compromised. Okay, so make sure you watch that video. That's one that just came out not too long ago on our traction training. Anyway, let me get back in here. Let me move these aside so we can keep track of all this stuff. I pulled all this stuff up before we got started so I could be really complete and comprehensive in this. Okay, so now the goal with the adjustment is I'm contacting the 7th cervical, and the goal is to lift and set that bone forward with the tip of the finger. So we're contacting with the tip of the finger. We're not twisting the neck. We're not rotating. We're contacting on, this is the thoracic spine, but we're contacting on the spinous process, so that little prominence, and the goal is to lift and set it forward. That's some of the differences in the Gonstead work, is how we contact and how we adjust the spine. It's done very different than other methods that you may have seen before. It's not done with the patient laying face up and twisting side to side. It's done in the seated position or face down where we set the bone forward. So those are some of the different nuances from technique to technique, but that's something that you'll see in the Gonstead work.
Lift chin.
Okay, so I say lift the chin and he relaxes a little bit more. We'll watch it again.
Lift chin.
And the goal is for them to come up like this when they get adjusted. And you'll notice he does. He doesn't do this. His head doesn't whip across and throw spit against the wall, is basically how we were trained on this. You don't want to do that. You want to make sure the head comes forward. That means that we're putting the corrective vector of force into the joint in what we're trying to do as a Gonstead adjuster. So one more time and then we'll move on, because I know everyone loves to see cervical spine, loves to hear the sound, right?
Lift chin.
Okay, now, next thing we're gonna do is he's going prone on a high-low. So a high-low is a table goes up and down. That's helpful because after a patient's adjusted, they can come back up without having to climb off the table. There's an argument that says maybe, you know, a few seconds or a few minutes after someone's adjusted, if they move abnormally, they could compromise that adjustment that you just did, possibly affect some of the good work, right? So we go through here, we're explaining.
Forward through the plane line of the disc. I'm actually pointing on your x-ray right now, Roger, where you're face down. You know, or like golf. You know, if you're off 1 millimeter, the ball goes in a completely different direction.
So just making the comparison to a specific adjustment is kind of like a martial art. You know, it's a skill. It's not just muscling something in, but it's using technique, and kind of like golfing. You know, if you hit a golf ball off a millimeter, it goes a completely different direction. That's the way we think about this from a segmental standpoint. We try to be as specific as possible when we deliver an adjustment. So we're counting down first. That's the first thing we do. Prior to ever adjusting anyone, we don't just put your hand on the spine and start moving stuff around. We don't feel around while a patient is face down and determine what's going to be worked on. It's already figured out from the seated examination, we have the x-ray up on a screen. You can see there, it's a big 40-inch screen. And we can see the shape of the anatomy, the shape of each vertebra, so that as we're palpating down, we're looking up at that blueprint as well for specificity, to make sure that we are on the segment that we think we are on. So these are just some of the nuances and differences in more specific levels of chiropractic care. Okay.
Drop those shoulders down.
Okay, and so he is definitely a little bit more difficult to adjust. That's why it took 2 attempts there. Okay, and actually there's a 3rd attempt and I changed my hand placement. This is real, this is how it works, this is unedited. Sometimes the first attempt we go to adjust someone, it doesn't move, and this is a guy I've worked on probably a good 15, 20 visits. He's about, 3/4 of the way through his phase of care. We're coming up on taking a comparative x-ray with him pretty soon. I think we set this now with a different contact called nail point 2, which uses the 5th metacarpal phalangeal joint right in here. It's a nice little hook that can go right underneath the spinous process. So if this is, turn my spine the right way, like this, and set that forward. So let's see how that does.
Breathe, drop the shoulders. Got that one.
Cool, he said you got that one, so that one moved. And we'll keep going.
Yeah, you're not gonna, oh.
Okay, so then we go, I think this is L2.
5, 12, 11.
No, this is T11, sorry, T11.
Yeah, that one doesn't go, you shouldn't move.
And he's a tough one. Okay, so again, unedited, you're watching how this thing works. We go in with a different contact. There it is. So that was T11. I set that with clockwise torque, or sorry, yeah, that was T11. T11 clockwise torque, that's this one right here. And for those of you chiropractors watching this, it's pretty much a PLIT, but I set it piezoform spinous on the right inferior portion of the spinous, and I'm torquing it clockwise. Okay, again, if there's a lot of rotation, I'm gonna be more working on one-sided and trying to derotate the joint. But at T11, because it's slightly, well, it's definitely right convex curve. It's definitely laterally flexed, okay? But spinous contacts are a deeper setting. And so as much as possible, if I can justify a spinous contact, I will. And like I said, if the segment is extremely rotated, then I'll get off a little more lateral to try to help with that rotation. But in a case like this, absolutely what you want to do is, because there is a right convexity, okay? So the spine, if we're looking at the patient laying face down, there's a right convexity. You want to focus on your contact being on the right side and a slight right to left thrust. Okay, so the vector of thrust has to angle P to A, so posterior to anterior, and slightly right to left. Okay, all right, let's keep going here.
I know, I had to fake you out on that one. Yeah. You got it though.
My body just doesn't.
Yeah. You're on very high guard.
It's interesting, I was noticing.
Okay, so anyway, so that's pretty much what I wanted to cover on his visit here. Now I'm gonna pop over to this. Actually, I'm gonna pull up a couple things here. So now here's what we do. We take x-rays, we go through this movement assessment, and I wanna show you what the movement assessment looks like. I'm going inside of our program that we have for chiropractors called MoveNow University. I'm going into our MoveWell 3, which is our movement assessment, and this is a case study portion. And so Kaylee, who used to be my scribe, my assistant, she filmed lots of videos with us going through patient demonstration stuff. And so myself, Dr. Zach, we go through a movement assessment. We show it on film here. This is what Roger went through on his second visit, okay? So mind you, Roger is in an active phase of care where we have goals of of structural and functional change that we're looking to affect with him, and then remeasure these things and then show pre and post findings so that we can actually objectively improve things going on with his health and not just try to affect symptoms. Not just say, oh, you came in with neck pain, low back pain, shoulder pain, and knee pain. Does it feel better? Okay. No, it's you came in with that stuff. All of those things are symptoms of underlying dysfunctional causes, whether it's movement, posture, segment. All three of those have to be assessed for us to really attack this the right way for long-lasting results, okay? And then we teach our patients what they need to do for a lifetime to maintain this. And on top of that, one of those things is getting stronger, building strength. We use kettlebells. We actually train our patients in various kettlebell movements to reinforce these healthy patterns and to build strength. So all of our patients, doesn't matter if they're 70s, 80s, or if they're 20 years old, we're teaching them safe and effective kettlebell movements, very simple type of exercise equipment, cannonball with a handle on it. They can get some of these at home, and then they can continue on this thing that we a lot of times introduce them to in our clinic, and then show them how to do this safely to reap the benefits of resistance training.
Dr. Todd from MoveNowU. I'm standing here with Dr. Zach. And
this is just showing a movement assessment, just to give you an idea of how we do a movement assessment. So Dr. Zach goes through this with Kaylee to demonstrate.
Right after me.
So we're going cervical patterns, and this is showing the little form of how we go through it, and we're essentially looking to see, is the patient able to do the movement, yes or no? So is it functional? And so it's either functional or dysfunctional, and is there pain with it? And if there's pain with it, that has a different scoring, and if it's dysfunctional, has a different scoring, then we add that up, right? We use this for comparative purposes, and we also use this to program out protocols and prioritize what types of intervention are going to be done in office. So that was thoracic rotation. This is a squat.
Go. Any pain with that?
Okay, they're reporting if there's any pain with the
straight leg raise?
Straight leg raise to analyze what's called the posterior chain, the muscles in the back of the body.
And try to keep your knees parallel.
Okay, glute bridge. And then Faber test, or Faber, if you want to say it like that, which is a hip range of motion, leg lowering.
Slowly bring your legs down.
Which is actually testing core stability.
Come down. Go ahead.
And this is the Thomas test. Okay. And then after that, we break out any abnormal things going on. This is shown in a couple different videos here. We did shoulder breakout, squat breakout, for example, but just to sneak peek and show you briefly. And again, this is a lot of in-depth stuff, I know, if you are a patient or someone in the public looking at this. Okay, but if you're a chiropractor, you're seeing this, you might be familiar with some of this stuff. This might intrigue both audiences, so I just figured I would show this to whomever wants to watch this video. This is how we do stuff. Again, this portal that I'm showing you, this is inside of our doctor training portal that we built out, that we train doctors all around the world. They fly into our clinic 3 times per year for in-person seminars. And this is a resource for them and their team to learn these systems and refer back to them for ongoing training.
Is heels...
This is just showing how we modify her squat with a heel lift to then see if her squat becomes more functional.
Of your heel.
And this is showing
then stick the pole.
Ankle range of motion test. Okay, so enough with that. Now, as far as with Roger, so we looked at his posture. All right, you can see he's shifted over to the side. So he's shifted over to his right. All right, remember this one, obviously we're looking at him as if he's facing us, right? So this over here is his right, this over here is his left. He shifted to the right. You look at his x-ray as if we're standing behind him, okay? So I'm not quick enough to flip the x-ray around right now, but on the x-ray, this is his left and this is his right. Gets a little confusing, okay? But here he shifted to his right, and over here, this is his right on this side, this part of the spine shifts to the right. This explains why he has that right shift presentation. And you really need an x-ray to understand the patterns so that we can target specific areas with corrective exercise and even traction, spine remodeling traction. There are 2 tractions that this patient is doing, and one is to help with that big shift and bend that's going on down in here. And the other one is to pull that mid back forward, because on the side view, he has too much curve. And again, we did a whole other video on pretty much a breakdown of his case, how we did traction with him and whatnot, but he has too much curve in his mid back. He has almost a 62-degree curve, which is highlighted up here. Should be a mid 40-degree curve. So he's gained almost 41% too much mid back curve. So that's a problem, and we're trying to reduce that. And the other video, like I said, really goes into detail, talks about how a thoracic hyperkyphosis, or too much curve in there, is even linked up in the research with reduced health outcomes, decreased life expectancy. It's a very important thing to tackle. It improves function tremendously once you start to reduce a curve like that. And he'll have a comparative x-ray to measure how much we were able to reduce that curve. This is called a recommendation card. This is where all the moving pieces of his care are put together in one place. In our clinic, we have 3 different departments. We have the chiropractic end, so how we adjust someone. We have a traction department, and then we have functional movement corrective exercise. So in the functional movement side, our therapists look at this, they see all the different exercise protocols that we mapped out for Roger to do. In the traction department, they see the traction mapped out. It's written out in detail below. There's home care, meaning there's stuff that our patients take home, and they're taught how to do this at home repetitiously. So even when they reduce the frequency with us in office, they have a program and a protocol that they can carry on their own, and a lot of times indefinitely, to maintain that proper level of spinal health and overall health that we just taught them. So ultimately, our goal is to empower our patients and teach them habits and teach them what they need to do to fix themselves. And we coach them along, we show them the way. Now, there's always a time and a place for getting your spine checked and adjusted, kind of like going to a dentist. You don't go to a dentist when your teeth hurt. You go as a preventative. Same thing with a corrective chiropractor. You come see us not when you have a problem, you come in at some frequency to get checked, even after you've accomplished changes and shown those changes on pre and post x-ray and improvement in functional assessment. You want to maintain this stuff before you have pain, before you have a problem. I personally like to get my spine checked about every 2 weeks. I recommend patients get checked if they're active at most every 2 to 4 weeks. If someone's less active, they can get checked a little less often, but why would you want to be in the inactive category? You don't want to do that. So anyway, that's his recommendation card. Something up here in the recommendation card, I know this is going to be kind of small, but this right here talks about protocols, functional movement protocols. It says D1 through D8. We have that because D stands for dysfunction. And I'm going to toggle over here real quick, and I'm just going to show you. This is what our patients get when they start care with us. They get a journal, and this is what we teach inside of our program that other chiropractors use with their patients. So this is called the 12-week transformation. When you go through care in our clinic or another MoveNow chiropractor, they use the 12-week transformation. You will get access to an online membership site that goes alongside the 12-week transformation. What's the purpose of this? It's so you have resources, you have an exercise library, and you learn content over a 12-week period of time that teaches you how to get and stay healthy for a lifetime. We cover a handful of different topics in the 12-week transformation. I'll flip over there real quick. This is our online portal right here. And how it works is inside of the 12-week transformation, there are 12 weeks. And when a patient starts with this, they can only see week 1. It's drip fed, meaning week 1, only week 1 shows up. Week 2 opens up, and they get emails that tell them when each subsequent week opens up. But in each week, there are various topics that we cover. Spine, movement, lifestyle, fuel, and goals. Fuel is like food you should or shouldn't eat. And if you scroll down here, we talk about what is health, and then our why, the 3 pillars to health, which is segment, posture, movement. So we're really big about educating our patients. It's huge. You know, doctor really means teacher, and so we take that seriously. And then week 1 starts off, and you learn about thoracic kyphosis and life expectancy, the very topic that we're talking about right now. And then proper posture, standing, sitting, sleeping, setting goals, the importance of setting and tracking goals. It gets people inspired to start using this journal and actually start journaling your progress. As far as fuel, reducing sugar, probably the most important thing to start introducing someone is to start reducing sugar. And then goals for week 1. So you check in, you see where you're at. Your doctor sets specific goals of how many times you should be doing your home care throughout, and that's how it works. And then inside of this portal as well, there's an exercise library. And the exercise library down here, the cool thing with that is there's exercises that are plotted out for our patient to learn in office. They're encouraged to then do those at home. They're encouraged to even look at our programming and see what exercises they're about to learn. They can watch the videos on their own so that they're somewhat familiar. So when they come in an office and they're taught and cued in person, it's not the first time that they've ever seen them, but they're already somewhat familiar with it. And then they can refine and dig deeper, and they can get further through our exercise progression, which we actually call it the belt system of functional movement. I'm looking around to see if I have a belt here. Here we go. Here's a blue belt. See, it says results matter most. It says Gonstead strong. These are belts. These are wristbands that our patients wear. I'm actually a black belt, but I'll wear this blue one for the rest of this video, just because I'm talking about the belt system. So now, belt systems over here, it just makes it fun. It gamifies the process. All of our patients' first name, last initials put up on a wall on these boards that we have with martial arts belts that sit there. They start as a white belt, they go to yellow and blue and green, orange, and then black. And we only have like 6 black belts right now. Maybe the time you're watching this video, there's more black belts. But anyway, so back over to the journal that I wanted to show you. So patients get a journal. Roger got a journal, for example, and we explain lots of stuff to them as far as just showing them how to guide through care and have resources. No one in our clinic or in any of our doctors' clinics that follow these systems can ever say, "Doc, you just didn't give me enough resources to know what I'm doing." That never happens with this, because we make sure that we over-deliver and we really take education seriously. So this shows our foundational protocols that we map out based on someone's dysfunctions. So you do a movement assessment. Roger did a movement assessment. We identified what was functional and dysfunctional. I'll just show you. This is the level 1 screen. This is the level 2 screen. So there's various movements that we take them through, okay? And if they're functional, dysfunctional, or painful, we go through and mark this up. And then based on that, we have very easy ways of then saying, okay, well, based on this being dysfunctional, how are we gonna prioritize their exercises so that the patient can follow it along and understand it, so that our staff can instruct and follow along and understand it, and everyone's on the same page, and it's really cool. What we use behind the scenes to prioritize the exercises and track how the patient's doing. This is like an exercise progression card that we use in our exercise area. So for Roger, his primary issue is cervical dysfunction, then thoracic, then hip dysfunction, then posterior chain, and then core. So there's a list of exercises. All the ones in white are white belt exercises. So those are the ones that he's gonna learn for the first several weeks. Once he's mastered those white belt protocols, has no pain doing them, understands them, then we're gonna start to get into the yellow protocols. So they're yellow on this actual form, these yellow ones, okay? And then each step of the way, he can test, so to speak, for higher belt levels. And as he becomes more functional and healthier, he's doing that through our belt system. Now, let's just say like cervical dysfunction, okay? So if you just picture what that looks like there, keep that in your mind. Here, I'll keep this off to the side. I'll click back over to it. He goes to the 12-week transformation and he says, okay, what'd you tell me again with the cervical dysfunction? Let's take a look at that. So look, it's the same layout. And now each one of these things for cervical dysfunction, okay, so see it carries over right here. He can then grab this and click on a button and it pulls up a protocol and he can watch this. Hey everybody, Dr. Todd from these parts of the lat that pair with this, and it hooks this into the muscle, taut and tender. And so it's showing like a pin and stretch technique. Pressing. But essentially it's a step-by-step video that our patients have access to. And you can add some motion to it. Okay, pretty cool. So that's just giving you an idea of what our patients go through and the systems that we provide to make this seamless, to make this work really well, really easy. And we'll end with what? 12-week transformation. Okay, here's 12-week transformation. So I think that's a good place to stop. We'll wrap it up. Comment below. Let us know if you like the format of this video, of us just going through a case from start to finish. Let us know what kind of questions you have, what else you want to see. If you haven't subscribed to our channel, please subscribe so you can stay in the loop and you can see these new videos coming out. Share this with someone else that you know that is contemplating chiropractic but thinks that they know all about chiropractic. You can show them there's a very different style of chiropractic, very complete segment posture movement, what we do here at Gonstead Spine and Wellness, what we teach with MoveNow University. Share this with them. Reach out to us if you're looking for a MoveNow doctor and you can't find one in your area. We will communicate with you and let you know if there's someone close by. I think that's all I got for you. So at the end of the day, why do we do all of this stuff? We do all of this because we are extremely serious about results. Our motto in our clinic is, when it comes to the health of you and your family, results matter most. And that's how we end it.